So hi, my name is Erica and I'm here to talk about my research on penicillin allergies. As you may know, a lot of people claim to have a penicillin allergy. In fact, you may claim that you have one as well. Perhaps you don't know why you have it, but your mom just told you at a very young age that that's a drug that you have to avoid. And if you haven't experienced this, I'm sure you know somebody who has told you this story about themselves. And you guys are not alone because actually 10% of the population claims to have a penicillin allergy. However, it's not well known, but of these people, a very small amount of people actually have a true penicillin allergy. In the current literature, it's shown that when people go for testing for penicillin allergies and they test negative on their skin testing, they can actually tolerate oral doses of penicillin. And of these people, only 1.2% will have an IgE-mediated reaction. IgE-mediated reactions are hypersensitivity reactions that occur within 24 hours of ingestion of penicillin. And examples of these include anaphylaxis. So these are life-threatening reactions that I'm sure that many of you are aware of. So it's very important that we verify penicillin allergies because not many people have these life-threatening allergies to penicillin. 10% of people claim that they have allergies and only 1.2% have IgE-mediated reactions. And with this verification, then we can actually perhaps give more patients penicillin rather than avoiding penicillin and using other antibiotics that may be more harmful or cause further infections in patients and increase their hospital stay. So with this research, I thought maybe we could try and reduce, in the big picture sense, reduce healthcare costs and patient morbidity. Okay, so what I did was that I looked at 284 patients who frequented an allergy clinic in Windsor between the dates of April 2011 and December 2014. And all of these patients, we looked at whether or not they had skin testing, intradermal testing, or oral doses of penicillin, and whether they reacted positively to these tests. And all of these patients, these 284 patients, had previously stated that they were allergic to penicillin. What we found, which was very interesting, was that actually only 8% of the people who stated that they had a penicillin allergy actually reacted positively to either skin testing, intradermal testing, or oral doses of penicillin. So that means that of the 284 patients that we looked at, only 23 patients reacted positively. So of these 23 patients who reacted positively, there were 6 patients who reacted to skin testing or intradermal testing. There were 5 patients who reacted in an IgE-mediated reaction within 24 hours of oral ingestion of penicillin. And then there were a higher number of people, so 12 patients who reacted with a delayed type reaction, meaning it was greater than 24 hours after the ingestion of penicillin. Of all the reactions, there were 7 people who developed hives, and there were 12 people who developed a red rash. Of everybody, there was nobody who reacted with any cardiopulmonary compromise, so there were no life-threatening reactions. So of the 284 patients tested, nobody had a life-threatening reaction. So from my research, it's interesting to note that lots of people claim that they have penicillin allergies, but not many actually do. So only 8% of the people I looked at had a positive reaction. And of these 8%, most of them had a delayed type reaction after 24 hours, and most of the reactions were just simply a rash that is non-threatening to life. So with this knowledge, we can then move forwards to perhaps test more people who claim that they have penicillin allergies and verify whether or not we should be giving them penicillin or other antibiotics. This can help us to reduce the use of other antibiotics that might cause antibiotic-resistant infections such as MRSA, VRE, or C. diff. And in turn, this can decrease patient hospital stay, decrease patient morbidity, and help improve the healthcare costs in our community.